Hello, hello everyone, hello everybody. I apologize for starting late. It's the 20th of January 2015, approximately 7:18 a.m. Central Time. And I'm Dr. Chinyere A. Ugoji, MD, MBA in the Electronic Residency Application Service 2015, updated licensing documentation in current clinical practice and graduate medical education, masters in public health, core social and behavioral sciences at Capella University, Minneapolis, Minnesota, American Mock Interview Season, public health project on sexual violence, domestic violence, child abuse as a public health continuum with University of Texas Southwestern Medical Center, Dallas, Texas, and the Rich Higher Let's Move initiative of the First Lady of the United States of America, First Lady Michelle Obama, with my 3-year-old son, Kingston Eke. Yeah, I'm welcoming you to Dr. Chiquito Mentoring Iridescence Educational Global Collaborative Ustream YouTube show, a Rich Higher and Let's Move initiative of the First Lady of the United States of America, First Lady Michelle Obama. I would like to share some famous quotes and healthcare recommendations from healthcare administrators. All these are listed on my WordPress website, and I want to invite you to check out the quotes from the President of the United States of America, President Barack Obama, on the 2nd of February 2007. And also the quotes on the White House internship on the 2nd of May 2009, and then the quotes on the Rich Higher initiative by the First Lady of the United States of America, First Lady Michelle Obama, on the 22nd on the 16th of January 2014, and then a quote by me on my graduate medical education curriculum review on the 25th of October 2014. All this can be found on my WordPress website. And then also I want you to also check out an excerpt from a letter of recommendation from Dr. Janet Albers, MD, Program Director, Emeritus, Southern Illinois University Family Medicine Residency Program, Springfield, Illinois. And also an excerpt from a letter of recommendation from Dr. Sean Drake, MD, Program Director, Henry Ford Internal Medicine Residency Program, Detroit, Michigan. And also an excerpt from a letter of recommendation from Dr. Kimberly Baker-Gino, Program Director Emeritus, Henry Ford Internal Medicine Residency Program, Detroit, Michigan. So today we're going to go ahead and do the mini mental studies examination. It's a fun activity that we normally do each time that we have a show. We were unable to have a broadcast yesterday. It was Martin Luther King Day, and I want to wish everyone a happy Martin Luther King Day officially. And apologize for the break in transmission. I'm pulling up some slides here. Yes, so I want to officially wish everyone a happy Martin Luther King Day, a celebration of the history of the United States of America, the archetypes, the values, the syntax, the heritage, the culture, education, health, and global diversity. I also want to officially wish the First Lady of the United States of America, First Lady Michelle Obama, a happy 51st birthday on Dr. Chiquito Mentoring Iridescence Educational Global Collaborative Educational Ustream YouTube show, a Reach Higher and Let's Move initiative of the First Lady of the United States of America, First Lady Michelle Obama. And I also want to share a celebration, a birthday celebration of a member of my family, my mother, Miss Rose Akalono. And I also want to invite you to share your educational journey and also your celebrations on this show. So we're gonna go to the mini mental status examination, the St. Louis University mental status examination, modified by Dr. Chinyere Ugoji, MD, MBA. Actually, due to some technical issues, we are not going to be able to feature that today. We are going to go ahead to the next section of the show. And that will be a case study that would be the graduate medical education interview question for today, which was supposed to be featured yesterday for the interviewer and also for the interviewee. And so the graduate medical education interview question for the interviewer, which could be the program director, the faculty member, the residents, the staff, and also the medical student, would be: is there possibility of protected time for research? So unprotected time for research is part of the graduate medical education curriculum. And I've done research on various topics, including the patient's average length of stay and other research studies, which I hope to publish in the near future. So the question for the interviewee, which could be you or me, even as we are on the expedition for the graduate medical education fit for our goals, would be: what is the concept of the patient-centered medical home? So the patient-centered medical home is a primary health care delivery model emphasizing collaborative continuous care, coordination, and communication by a team-based model led by a physician assistant, or a nurse practitioner. Maximizing healthcare outcomes, utilizing health information technology, current practices and recommendations with a flow sheet ranging from recognition, acquisition for patient-centered medical home, training for various practice sites, transforming practice standards, and maintenance of patient-centered medical home status, an integral part of graduate medical education. Building on the work of a large and growing community, the Agency for Healthcare Research and Quality, the AHRQ, defines a medical home not simply as a place, but as a model of the organization of primary care that delivers the core functions of primary health care. Agency for Healthcare Research and Quality, 2014. That's the definition of the patient-centered medical home, which is an integral part of graduate medical education, and also in family medicine as a specialty. So next we go to the graduate medical education curriculum review, and we're going to talk about pediatric milestones today. And I would like to state that as a single mother for 2 years, I've had successful outcomes in pediatrics, and also that graduate medical education offers comprehensive training in pediatrics, which is as a longitudinal rotation from obstetrics and gynecology. And my pediatric competency improved in medical education and also in graduate medical education, with evaluation and feedback from medical educators, including Dr. Janet Albers, MD, Program Director, Southern Illinois University Family Medicine Residency Program, Springfield, Illinois. Dr. Laura Lossil, MD, faculty member. Dr. Tabitha Wells, MD, resident, and now faculty, and has transitioned into my graduate medical education competency and faculty development interest. So we are just gonna go over the normal pediatric developmental milestones. At birth, we'll talk about various ages and the language skills, the movement skills, and the eating skills and the toileting skills. So at birth, language skills consist of crying. Movement skills consist of kicking legs, thrashing arms. And then at 2 months, the language skills consist of making sounds like or smiles. Movement, holding head steady when held sitting. Eating reacts to sight of bottle or breast. At 3 months, the movement skills consist of making crawling movements. And then the eating skills consist of one hand on bottle while feeding. At 4 months, the language skills consist of squealing, saying "I'll," and then also laughing. And then movement consists of holding own hands together. At 5 months, the language skills consist of making a raspberry sound. The movement skills consist of rolling over stomach to back. At 6 months, the language skills consist of babbling and responding to name. The movement skills consist of rolling over back to stomach. And then at 7 months, the language skills consist of da, ba, ga, ka, ma. And then the movement skills consist of sitting without support. At 8 months, the language skills consist of mama, dada, and baba. And then the movement skills consist of crawling. The eating skills consist of feeding self cracker or cookie. At 9 months, the language skills consist of imitating speech sounds that you make. The movement skills consist of putting self to standing. Eating skills consist of using both hands to hold the bottle. At 10 months, the language skills consist of understanding single words like bye-bye and night-night. The movement skills consist of sidestepping around furniture while holding on. 11 months, the language skills consist of using mama and dada specifically for parents. The movement skills consist of standing alone well. And then the eating skills consist of picking up spoon by the handle. At 12 months, the language skills consist of saying one word clearly. The movement skills consist of climbing up on chairs or other furniture, walking with one hand held. The eating skills consist of transitioning to sippy cup with milk instead of formula. Grooming consists of cooperating with dressing, removing socks, holds foot out for shoe, holds arms out for sleeve, pushes arms and legs through shirts and pants. At 15 months, the language skills consist of saying 2 words besides mama and dada, making sounds in sequences that sound like sentences and points. The movement skills consist of walks without help, crawls up stairs, feeds self with a spoon. At 18 months, the language skills consist of using 5 to 10 words as names of things, follows a few simple instructions. Movement consists of running stiffly. Eating consists of eating with a fork, drinks from cup using 2 hands. Bathing, dressing, and grooming consists of helps brush teeth. At 2 years, the language skills consist of 2 to 3 word sentences, beginning to understand rules of grammar like run, mouses, receptive skills, which exceed expressive skills. Movement skills consist of running well. Toileting consists of being ready for toilet training. And then the bathing, dressing, and grooming consists of removing unfastened coats, removes shoes if laces are untied, finds armholes in shirts, and helps push garment down. At 2.5 years, the language skills consist of referring to self as I, knowing full name, goes upstairs with alternating feet. The bathing, dressing, and grooming consists of removing pull-down garments with elastic waists, tries to put on socks, puts on front button-type shirt, unbuttons one large button. 3 years, the language skills consist of 300 to 500 word vocabulary. Speech is mostly understandable to strangers. May lisp, may stutter, may substitute W for R, D for TH, and T for K. Movement consists of standing on one foot momentarily, riding a tricycle. And then eating is one-handed cup holding, drinks from open cup without spilling. And then toileting consists of using toilet often, needs help with wiping after bowel movements, stays dry during the day, but occasionally wets bed at night. The bathing, dressing, and grooming consists of washing hands assisted, unbuttons clothing, buttons large front buttons, puts on shoes, maybe sometimes on the wrong feet, does not tie, puts on and takes off t-shirt with assistance, zips and unzips without separating or inserting the pennies. And then the language skills at 3.5 years consist of combining sentences using and, or but. Movement consists of hopping on one foot without support, cuts across paper with small scissors. Bathroom dressing and grooming, washes face without help. At 4 years, the language skills consist of vocabulary 1,500 words or more, speaks in 6 to 8 word sentences, may continue with lip sync, stuttering and sound substitutions as above. Movement skills consist of climbing well, hopping on one foot, holding utensils like an adult, makes own bowl of cereal in eating, toilet independently, nighttime bedwetting is still common, bathing, dressing and grooming. So the baby brushes teeth with supervision only, washes hand unassisted, removes t-shirts independently, uses buckles, zippers and laces, knows front and back of clothing, puts on shoes with little assistance. At 4.5 years, the language skills consist of reading a few letters, skips and broad jumps. At 5 years, the language skills consist of speaking fluently, may lisp, may stutter, may substitute F for TH and W for R, L or Y, may mispronounce 3 to 4 syllable words. The movement skills consist of swinging a few movements and also printing first name. Toileting consists of 20% of 5-year-olds still have nighttime bedwetting at this age. Bathing, dressing and grooming consists of dressing and undressing alone except some help with buttons, zippers, shoelaces, wants to bathe on their own but still needs assistance washing body and hair. At 6 years, they can spell some simple words. They may still mispronounce some 3 to 4 syllables words, may still substitute W for F, for R and F for TH, may still lisp and then stutters only when emotional. That's for language. Movement consists of somersaulting. Eating consists of using knife to cut soft foods or spread butter. Toileting consists of nighttime bedwetting, which is still common and is untreated till age 8. Bathing, dressing and grooming consists of buttoning back buttons and tying shoes. At 8 years, the bathing, dressing and grooming consists of selecting clothes appropriate for weather. So that's the pediatric milestones, and it's a very interesting part of pediatrics that and also a part of graduate medical education curriculum review, which is very integral to your pediatric patient encounters. So next we go to the next section of the show. It's 7:41 currently. I'm going to talk about the case study or exposition on sexual violence and domestic violence. But first of all, I would like to talk about the Powerball question, and I wanted to just have that question at the back of your mind even as we discuss this important case study, which is very important, which I have chosen to do a public health project on due to my interest in this topic with personal experiences. So the Powerball question is 1 in 6 women and 1 in 33 men will be the victim of a sexual assault at least once in their lifetime. True or false? Well, I want you to think about that question even as we talk about this case study or case exposition on sexual violence and domestic violence. So we'll talk about I apologize for the break in transmission. We'll be right back on this show. So we'll discuss the case study. It's a 33-year-old African American female who was in severe distress and crying uncontrollably when she was brought in by the ambulance into the emergency room and said, "I was raped," as the chief complaint. So we're going to talk about sexual violence, domestic violence, and later on we're going to talk about child abuse. So what is sexual violence? What is a form of what is sexual assault? I'm sorry. It's a form of sexual violence, and it includes rape, such as forced vaginal, anal, or oral penetration of or drug-facilitated sexual assault, groping, forced kissing, child sexual abuse, or the torture of the person in a sexual manner. And what is domestic violence? This is quite different from sexual violence. It consists of a pattern of coercive behaviors used by a competent adult or adolescent to establish and maintain power and control over another competent adult or adolescent with behaviors which can occur alone or in combination, sporadically or continually, and include physical violence, psychological abuse, stalking, and non-consensual sexual behavior, and each incident builds upon previous episodes, thus setting the stage for future violence. So what are the types of domestic violence? Well, physical abuse, the forms are listed. Sexual abuse, the forms are listed. Emotional abuse, the forms are listed. The forms and examples are listed. Financial abuse, the forms and examples are listed. Verbal abuse, the forms and examples are listed. In terms of epidemiology, which is the next section, how common is sexual assault and domestic violence? Sexual assault, 1 in 6 women and 1 in 33 men will be the victim of a sexual assault at least once in their lifetime. That's from William and Hida, 2013. For domestic violence, intimate partner violence alone affects more than 12 million people each year. What are the risk factors? That's the next section. Individual risk factors include alcohol and drug abuse, coercive sexual fantasies, impulsive and antisocial tendencies, preference for impersonal sex, hostility towards women, hyper-masculinity, childhood history of sexual and physical abuse, witnessed family violence as a child. The relationship factors are listed too. The community factors are also listed. The societal factors are also listed. The causes include socioeconomics, anger, power, sadism, sexual pleasure, psychopathy, ethical standards, laws, attitudes towards the victims, and evolutionary pressures. So the next section is the differential diagnosis. What are the differential diagnoses? Well, abdominal trauma, blunt abdominal trauma is a differential diagnosis. There are also other differential diagnoses including anxiety, asthma, candidiasis, and also ankle dislocations. What are the symptoms? Well, these are usually experienced by the victim and the witnesses during and after sexual assault, and they include presence of blood and or sperm, contusions, lacerations, joint dislocation, mechanical joint pain, abruptio placenta. And then also post-traumatic stress disorder can also result from sexual assault, as can also unwanted pregnancy and sexually transmitted disease infections. Now, what are the signs? The signs are similar to the symptoms that we just listed, except that they are diagnosed in a physical examination and also stated by the witness. Then, what are the laboratory studies which we need to order in a patient who is a victim of sexual violence or domestic violence? Well, they include complete blood counts, comprehensive metabolic panel, urinalysis, urine or serum pregnancy test in women of childbearing age, a serologic test for syphilis, hepatitis B, and human immunodeficiency disease, cultures of exposed body sites, approved nucleic acid amplification tests, wet mouth and culture of the vaginal swab specimen. In terms of imaging and ultrasound, comes in very useful. Procedures on echoposcopy and anoscopy may be very useful. Medications include ceftriaxone 125 mg intramuscularly in a single dose, metronidazole 2 grams orally as a single dose, azithromycin 1 gram orally in a single dose, 2 oral tablets and 2 oral tablets 12 hours later for pregnancy prophylaxis, tetanus and hepatitis B prophylaxis. In terms of consult, who needs to be consulted in this case, family physician, obstetrics and gynecology, rape forensics, sexual counselor, psychiatrist, psychologist. In terms of follow-up, regular follow-up with these healthcare workers is advocated. In terms of preventive care, the preventive care guidelines are listed, which is very integral to optimal health in patients of sexual violence, domestic violence, child abuse, and also in general patient population. So coding and billing, how do you get remuneration for this case study? Yeah, for this case, well, coding ICD-9, ICD-10, E960 is E960.1, T74.2, and then billing is 99202, which is due to the detailed history, physical examination, and low complexity decision making in 30 minutes. And we'll talk about coding and billing coming up soon on the show. The Powerball question, we talked about that, and that is 1 in 6 women and 1 in 33 men will be the victim of a sexual assault at least once in their lifetime. True or false? Well, the answer to that is true, and if that's what you answered, then you got it right. So references, I want to thank the author of this article for this wonderful information, which is very integral for us to be able to recognize, evaluate, refer, and treat, and also prevent prevent sexual violence, domestic violence, child abuse as a public health continuum. Now, the case study. I talk about my public health project, which is a public health forensic legal abrogation of case study on sexual, domestic violence, and child abuse. And the chief complaint is I was raped. Suspect is a 35-year-old Nigerian male. Victim is a 33-year-old Nigerian female. So and the details include sexual abuse, including vaginal and non-consensual penetration by a penis, with voiced non-consent and incomplete testing discussed with an incompleted testing discussed previously with the victim and families as witnesses. Financial abuse, described as confiscation of monies, clothing, and fraudulent activities, and refusal to assume financial responsibility of his family. Physical abuse during and subsequent to a pregnancy by the individual, and damage to governmental property, including a car and a house. Emotional abuse, mandates and picture emotional abuse, attempting abortion by procuring abortion medications with unsuccessful outcomes. Emotional abusive letters and behaviors, including running in public places, threats in legal courts, described as saying body and help, and inappropriate displays of emotion, described as crying in legal courts. Verbal abuse with letters and direct verbal abuse witnessed and reported to law enforcement officers and the court. The child abuse case study, the details are described as the suspect is a 35-year-old Nigerian male. The victim is a 3-year-old Nigerian male. Physical abuse is physical abuse by causing a head bruise on his head, pulling the child's hand, pushing him over in a chair, recorded by a licensed social worker. Verbal abuse to the 3-year-old Nigerian male at a police station. Neglect to the 3-year-old Nigerian male by underdressing the child in winter, dressing the child in dirty clothing, and neglect of medical care. Recorded in legal documents. And physical abuse recorded by Child Protective Services. emotional and psychological abuse with fear and repressed behaviors noticed by members of the child's family and having the child assume uncomfortable postures. So what are the optimal outcomes? I am working on this case presentation, and I'm gonna yeah which I hope to present as a poster presentation format. Um, um, so the outcomes include appointment of the responsible parents as the managing custodian parents, parenting classes, counseling, and child support exemptions for all parties involved, legal accountability and reform of all involved, and appropriately reported governmental agencies and individuals with authorized videoing, tape recording, testimonies, and evidence, optimal health of involved individuals as a public health continuum, and then mediation endorsements by both parties involved. So this was actually updated on the 20th on the 20th of January, and I will keep updating it with all the information for formal presentation as a poster with University of Texas Southwestern, um, Dallas, Texas. So with that, we'll go to the next section of the show. Which is a graduate medical education program exposition. And today I'm going to be asking a question, which is how can I get a face-to-face graduate medical education interview through the National Residency matching program through the March season 2015 with my updated graduate medical education competencies. And that's a question addressed to all graduate medical education, and it's not intended to violate any of the National Residency Match Program policies. And then for graduate medical education organizations, application for is an application for free educational collaboration at the American College of Physicians Conference, American Academy of Family Physicians Conference and Assembly, and other organizational educational conferences and webinars incorporating Dr. Chiquito mentoring, iridescence, educational global collaborative Ustream and YouTube show, a Reach Higher and Let's Move initiative of the First Lady of the United States of America, First Lady Michelle Obama, with Zumba dancing as a Let's Move initiative. So next session is from the White House. We're going to be talking about news from the White House here. Yeah, so from the White House, which is your source for up-to-date information, the weekly address by the President of the United States of America, President Barack Obama, is State of the Union is this Tuesday. Information on how you can be take an active part of play an active part in the State of the Union is listed on the website, and you can be able to share this information to encourage more collaboration. And I will be attending this State of the Union as part of my educational collaborative show and company, and I'll be asking the question. Yeah, so I'll be attending as a White House intern. As a White House internship applicant, collaborating on issues of education, healthcare, presidential council on this cited personal case study, and I'll also share some other healthcare news with you. From the American Academy of Family Physicians, the AFP board chair, Reed Blackwelder, MD, writes in the latest Leader Voices blog post, advising Americans to skip their annual exams. That advised Americans should skip their annual exams, minimized in the and with the importance of an ongoing physician-patient relationship, so which is very core to healthcare as a family physician and also as a physician generally. From the American College of Physicians, there's news about getting lowest possible rate for internal medicine mid in 2015. And information about registering by January 31st to get the lowest possible rate. From the American Psychiatric Association, there's information about traumatic brain injury and how to and information about recovery guidelines. I would just want to say that this is very common in sports medicine. If the patient has a concussion, they have to go to the emergency room, and then there are some other guidelines too, which I would advise you to read about. And then also from the American Academy of Pediatrics, there's information about infancy and continuing through early childhood, children's cognitive development affected by health, parent-child interactions and early education activities, which is very congruent to my Reach Higher Let's Move initiative at the early childhood and primary education level with my 3-year-old son, Kingston Ekel. So from the American Board of Family Physicians, there's a question of the week for those of you studying for board exams. Which one of the following is the major mechanism of action of metformin or glucophage? And the answer is inhibition of glucose production by the liver, which is B, and that's the mechanism of action of metformin. From the American College of Obstetrics and Gynecology, there's news about twins. In 2013, women had more twins than ever before, according to the CDC. So I'll read about this information. The CDC has actually talked about infertility in recent times, and then also the rate of twin births in the United States reached a 33.7 twin births out of every 1,000 deliveries in 2013. That's from the Center for Disease Control and Prevention. And with that, we'll go to healthcare in Spanish. We are actually just going to talk about a few sentences from healthcare in Spanish. We have been talking about pain, and we're going to continue about pain. And the question is, where do you feel the pain? And that's donde siente el dolor. Can you show me exactly where it is? And that's me puede mostrar exactamente donde está. Does the pain travel anywhere? That is el vahe dolor en el cuerpo. What is the pain like? ¿Cuál es el dolor? Can you describe it for me? ¿Puede describir por mí? Is it sharp, dull, burning, pulsating, cramping, or pressure-like? Es agudo, suave, ardiente, palpante, calambre, similar a presión? Is it constant or does it come and go? Es constante o aparece y desaparece? On a scale of 1 to 10, with 10 being the worst, how would you rate your pain? And that is en una escala de la 10, si de 10 el por, como calcificar su dolor. What brings the pain on? And that is ¿Qué trae el dolor en? Do you know what causes the pain to start? And that is ¿Sabe lo que causa el dolor para comenzar? Does anything make the pain better? And that is ¿Ha algo que algo el dolor? So that's more about pain, and that's how you can be able to ask the symptoms of this patient history on symptoms of pain, on the symptom of pain during your patient encounter. So with that, I want to thank you for being part of this show today, and being part of Dr. Chiquito Mentoring Iridescence Educational Global Collaborative Ustream YouTube show, a Reach Higher and Let's Move initiative of the First Lady of the United States of America, First Lady Michelle Obama. And I want to wish you a wonderful interview day, and I wish you a wonderful day.